Hello, okay, this is Dr. Bush. I'll be continuing from where I stopped yesterday on urinary stones. Now, today we'll be looking at some of the symptoms of urinary stones. That's some conditions that you have and you know that actually, okay, there is high probability that I'm having a urinary stone. Now, before we venture into that, I would like to let you know that a urinary stone can be asymptomatic. Asymptomatic means there is no symptom at all. So it can just be an accidental finding. Probably went for a health check. As the sonologist or sonographer is doing your ultrasound, he finds one or two stones deposited in your kidney or within your bladder. And probably went for a routine CT scan, abdominal CT, and they find some stones in your urine. It can actually be asymptomatic. But when the urinary stones are not asymptomatic, it presents with severe pain. As in when you say pain, it's actually very painful. In fact, some people have even attributed the pain of stones to labor pain, though not me anyway. Then some people even attributed it to the pain of being stabbed by a knife. That's the day is extremely painful. You feel like your world is about to end. So it's really, really painful. We'll call it urinary colic. Now the pain can either be by the flank, this way, or it can be at the back, or it can be in the abdomen. Or if it's lodged in the bladder, you can feel it just below your navel. So it's actually severe. Then another symptom is what we call dysuria. Dysuria is pain while urinating. If the stone leaves the kidney and lodges in the junction between the ureter and the bladder, it gives you that dysuria. As you're urinating, you'll be feeling a burning sensation, you'll be feeling pain. And if care is not taken, it may be mistaken for a urinary tract infection, and the stone gives that. Then another symptom you may notice is some of other lower urinary tract symptoms. That's you have what we call urgency. Urgency inability of an individual to control his micturition reflex. That's the reflex to go and urinate. You may not be able to control it. You find that as you're pressed before you get to the toilet, some have already started dropping down on your underwears. That's urgency. Then another symptom is what we call frequency. Frequency is going to the toilet frequently, as the name connotes. After urinating now, before you know, within a little space of time, you will feel like going back to go and urinate again. That's one of the symptoms of a urinary stone. Then another symptom is what we call hematuria. Hematuria simply means blood in the urine. Now, because this stone is lodged within your urinary system, it can actually damage the kidney or the ureter or the bladder. And when it causes an injury, all these structures will bleed inside, and as you're urinating, the blood comes out with the urine. That's what we call hematuria. So the stones can actually give you that as well. Now you can present with signs of infection. There can be high fever. I will talk about the complications of stone tomorrow, so that we understand how stones can predispose to infection, thereby